Morning, I'm Chris. Today is going to be my senior lecture. I decided to present my senior lecture on mindfulness, in part because it's something that there you go, helped me through residency, and it's something that's accessible to all of us. I'm not an expert in this topic, nor am I an experienced meditator, but the more I learn about mindfulness, the more convinced I am about its importance regarding our well-being. So I put this together in part to shine some light onto this topic and also to convince myself to practice mindfulness a little more, convincing. Commit myself to practice mindfulness a little more. So the outline for today, I'm going to be talking about what mindfulness is, why it's important, how to practice mindfulness, the evidence for mindfulness practice, how it relates to our profession, and how we can get started. So first, what is mindfulness? Mindfulness originates from the Pali language term sati, and a lot of different words and associations get conflated with mindfulness, such as awareness, attention, meditation, focus, concentration. But to be more precise, mindfulness is the awareness that emerges through paying attention on purpose in the present moment and non-judgmentally to the unfolding of experience. And I bolded the terms that are essential components of mindfulness. So you can think of our consciousness as a blank painting canvas, and the contents of our consciousness can be represented by the different elements of the painting itself. And they include things like our sights, the things we see, hear, smell, other bodily sensations, such as the sensation of breathing or temperature and pain, along with emotions and thoughts. And this painting is dynamic and changing from moment to moment. So mindfulness is pretty much paying attention to these different elements and components of our consciousness in the present moment in a non-judgmental manner. So we're not trying to change our emotions or thoughts, but rather we're simply observing the ebb and flow of experiences from moment to moment. To understand the importance of mindfulness, I first want to talk about neuroplasticity. It's a common misconception that neuroplasticity stops after a certain age, but neuroplasticity is actually a continuous lifelong process. And there are different forms of neuroplasticity, such as structural, functional, synaptic plasticity, among others. And while the extent to which our brain changes differs throughout our lifetime, it occurs until the moment we die. Another concept that I wanted to touch upon is that a wandering mind is an unhappy mind. So two psychologists, Killingsworth and Gilbert, published an article in Science where they developed an iPhone app that periodically surveyed people's thoughts and activities. So these users would be interrupted at random times throughout the day, and they would be instructed to fill out a questionnaire about what they were doing, what they were thinking about, and how happy they were in that exact moment. And Killingsworth and Gilbert found two important findings. They found that people spend about 47% of their waking hours thinking about something other than what they're doing. And the second finding is that this mind wandering typically makes them unhappy. And theoretically, that makes some sense. We tend to focus on negatives because negativity bias serves an evolutionary basis. It's more critical to survival to avoid a harmful stimulus than to pursue a potentially helpful one. And in this way, negativity bias has become maladaptive in our modern world. Most of our stressors nowadays are psychological ones rather than physical ones, like running away from predators. And it's kind of similar to diseases like sickle cell disease, where it serves an evolutionary purpose, but has become maladaptive in regions where malaria has a low prevalence. Although there's a wide spectrum of neuroticism and emotional reactivity, when our mind wanders, it often ruminates in past regrets or mistakes, or in future worries or desires. And both of these take away from the present moment. And when our mind wanders, certain brain networks and regions become more active. So the default mode network was first discovered through studies of brain activity during passive states, such as non-goal-directed activities. The default mode network, or the DMN, is a network of brain regions that is more active when we're not engaged with our environment, so such as mind wandering or when we have self-referential thinking. And it deactivates during more cognitive tasks. In a large meta-analysis investigating brain networks of depressed patients during these resting states, it was found that major depression was associated with hyperconnectivity within the DMN and hyperconnectivity between the frontoparietal control systems and regions of the DMN. So far, to sum up, we talked about how neuroplasticity is an ongoing lifelong process, how mind wandering is very common in our waking hours, and how we tend to focus on the negatives. And as a result, mind wandering reinforces neural pathways that perpetuate mind wandering. However, we can shape our minds just as we are able to shape our muscles through exercise. And we can do this through meditation, which is the intentional practice to help develop our capacity for mindfulness. Meditation can rewire our brains to stay more present and to avoid our minds from straying away and from unproductive wandering. We've all experienced moments of intense focus, such as during like practicing an instrument or practicing a sport or during studying or when you're immersed in a movie. Mindfulness meditation is similar in its focus during the present moment, but it differs in that it involves a conscious effort to stay aware and acknowledge when your mind starts wandering away. So just like we can strengthen our muscles through exercise, we can also strengthen our minds through meditation. There are many different types of meditation practices. The focus of this talk is not to talk about how to meditate or the variety of practices, but rather on the benefits and its importance. But broadly, there are two main categories. So focused or concentrative meditation focuses on a single point of attention, like your breath, to train the mind to stay more focused. While open or monitoring meditation involves a broader awareness of all sensations and thoughts without trying to control or focus on a specific object. But oftentimes, meditation practices involve both of these techniques for a more holistic and balanced approach. So if we go back to our painting analogy, where our consciousness is a blank painting canvas, and the contents of our consciousness can be represented by the painting itself, we often see that our thoughts and our emotions hijack our consciousness, and it attaches to our identity. And the goal of mindfulness is to train our attention to notice when our mind starts wandering away in a non-judgmental way, so that we can bring our attention back to the present moment. And this will allow us to detach our identity from our thoughts and emotions. So meditation can bring about moments of bliss, just like when we are intensely focused on playing an instrument or sport. But these feelings and this concentration often disappears soon after the activity ends, and our default mode network becomes active once again. This is termed an altered state by Doctors Goleman and Davidson in their book Altered Traits. But the main goal of meditation is not to achieve these altered states. It's more so to embed mindfulness into our day-to-day activities and maintain mindfulness even outside of meditation practices. And when this happens, a new baseline state of mind emerges, and this is termed an altered trait. They also found that there's a dose response, so the more you meditate, the greater the benefits. So what is the evidence for meditation? This is a graph that shows an explosion of mindfulness research publications since the 1990s. However, when Dr. Goldman and Richardson vetted these papers, they found that a lot of these papers had limitations and poor methodologies. And there's a lot of hype and exaggerated claims about mindfulness, so it's important to be aware of these limitations. Some of these limitations include experimenter bias. So when the researcher's expectations affect the participants' behavior or results, and to help combat this, you can employ skeptical, impartial scientists and replicate study findings. Additionally, people who have meditated before or who believe in the benefits of meditation are more likely to enroll in meditation programs and report the positive benefits of meditation. And by using a waitlist control, this can help eliminate some of the psychological confounds, because it's the same group of people who would want to enroll in the study, but it takes away the immediate expectations of the intervention. There's, as mentioned before, there's a bunch of different types of meditation techniques and methods. So it's important to specify the meditation method used in the study and to match with a comparable control. And a lot of the poor quality papers don't specify the quality or the lifetime hours of meditation. So by asking meditators to document and report their estimated total lifetime meditation hours, it can help standardize things a bit more. There's also the Hawthorne effect, where participants will change their behavior simply because they know that they're being observed. And you can account for this by using an active control group, such as a comparable intervention. So for example, instead of comparing a group of participants who underwent a 2-week retreat to participants who didn't undergo any retreat, a better active control would be participants who underwent a 2-week aerobic exercise program, because they also have some expectations about the intervention. And lastly, a lot of the older imaging studies focus exclusively on brain anatomy, but neuroscience has shifted away from exclusive focus on anatomic brain and towards the links in system and networks. And this is largely due to the advent of fMRI. So after winnowing down the available papers to around 60 highest quality papers, the authors of Altered Trait identified certain changes in our mind that persist. And the first one I'm going to talk about is resilience to stress. So mindfulness-based stress reduction and mindfulness-based cognitive therapy are both psycho-interventional therapies that are based in mindfulness. And both are well-studied techniques for reducing stress, anxiety, and depressive symptoms. MBSR is more focused on managing stress and improving our well-being, while MBCT focuses on shaping our perspectives and changing how we relate to our thoughts and feelings. This is a randomized control trial that was published in Lancet in 2015 called the PREVENT trial. And in this paper, adults with at least 3 previous major depressive episodes and on a therapeutic dose of maintenance antidepressants were randomized to either mindfulness-based cognitive therapy with tapering or discontinuation of their antidepressants, or to a control group where they were maintained on their antidepressants. The primary outcome was prevention of depressive relapse or recurrence over 24 months. And the authors found that the time to relapse or recurrence of depression did not differ between the two groups over 24 months. So in other words, the group that received mindfulness-based cognitive therapy with tapering or discontinuation of their antidepressants was not inferior to the group that just simply continued their maintenance therapy. There's also evidence that mindfulness meditation changes the structure and function of our brain. So Taylor et al. Showed that daily 20-minute mindfulness sessions for 2 weeks in non-meditators reduced amygdala response to stress images. And Golden et al. Also showed that when they used an active control group like aerobic exercise, they showed that 8 weeks of MBSR also lowered amygdala activity. And the amygdala is an area in the brain that's responsible for processing emotions, specifically fear, anxiety, and aggression, and it triggers the fight or flight response. And there are also long-term benefits. So research suggests that these changes become trait-like. So Krell et al. Showed that there's a stronger prefrontal cortex amygdala connection, and the prefrontal cortex manages emotions while the amygdala reacts to stress. So this suggests that mindfulness meditation may improve one's emotional resilience and impulsivity. Two other papers, Sarin et al. Showed that 3-month mindfulness training led to less anxiety, improved emotional regulation up to 5 months post-retreat. And a 2014 systematic review and meta-analysis published in JAMA looked at 3,515 participants, and they found that mindfulness meditation programs had moderate evidence of reducing anxiety at 3 to 6 months. The next alter trait I'm going to be talking about is attention. So Lutz et al. Found that mindfulness meditation strengthens our selective attention, which refers to our ability to focus on particular objects or tasks while simultaneously ignoring distractions. There's also evidence that it improves our sustained attention and working memory as well. And another paper shows that it can reduce our attentional blink. And attentional blink can be thought of as a blind spot in our attention. So if you take a look at this picture, when someone is rapidly shown 2 visual targets in quick succession, people often fail to identify the second target when it's placed too closely to the first one. And it represents our attentional capacity. And there's also evidence that with long-term meditators, there's reduced attentional blink with aging. And just like with emotional resilience to stress, there are also structural and functional brain changes when it comes to attention. So Lazar et al. Showed that there's increased gray matter density in brain regions linked to attention, interoception, and sensory processing. And there's another study where regular meditators were compared to non-meditators using fMRI adapted Stroop task. And the Stroop task is a psychological test that measures how well someone can ignore a word's meaning and focus on its color. And they found that in the incongruent arm, the meditators and non-meditators achieved the same performance, but the meditators had less activation of brain regions, suggesting that it's more effortless for them. And the last alter trait that I want to talk about is empathy and compassion. So there's a certain type of meditation called metta meditation. It's an ancient practice that focuses on cultivating kindness and love, first for your loved ones, then gradually expanding it out to include neutral and then challenging individuals. And there's evidence that metta meditation or compassion meditation can improve all 3 types of empathy. So there's cognitive empathy, where you're simply trying to understand a patient's or an individual suffering. There's emotional empathy, where instead of just trying to understand them, you actually feel their suffering. And lastly, there's compassionate empathy, where in addition to actually feeling their empathy, you develop a desire to help and support that individual who's undergoing suffering. So in the research project, a 9-month course with loving kindness practice, participants had increased warmth towards others compared to a control group. And Kiang et al. Showed that after a 6-week loving kindness meditation class, participants had reduced implicit bias against stigmatized groups. And they used a strong control group, which was a 6-week loving kindness discussion without the actual practice. And interestingly, even brief loving kindness meditation boosts social connection and positivity towards others. And this suggests that we may have a biological preparedness for goodness and compassion. And lastly, Wang et al. Showed that compassion meditation activates circuits for compassion and circuits that register the suffering of others. So overall, compassion meditation enhances empathic concern and prepares someone to act when suffering is encountered. So it's pretty clear how these altered traits relate to our profession. Resilience can help with reducing burnout. Attention can help with managing the increasing complexity and amount of medical knowledge that we're required to know. We have multiple simultaneous distractions, such as phone calls and EKG reads. And enhanced attention can also improve our teaching mission. And lastly, empathy and compassion can help with addressing compassion fatigue, improving communication and relations with colleagues and patients, and also reducing implicit biases. So ways to get started. First, you want to find the practice that resonates. It's better to find a technique that kind of fits your preferences and so that you'll stick with them. And in the beginning, you want to find a quiet environment with less distractions so that you're able to enhance focus. And you want to make a habit out of it. So a 10 to 15-minute session every day is a good start. And remember, there's a dose effect. So the more you meditate, the greater the benefits. And you want to be patient with the practice. The benefits are often gradual. So go into the practice with an open mind. And remember that the more you practice, the more you'll see the benefits. And there are many guided meditation apps out there, and they can provide structure to your practice. These are some of the more popular ones that are available. And then lastly, remember meditation is a skill, just like learning a bike or learning an instrument or playing a sport. And lastly, I just wanted to thank everyone for listening, and I'm extremely grateful for the training that I got from Kings County Hospital. And I'm just very grateful for all the people I've met and encountered. So, thank you very much.